Kimberly, Executive Director with Sierra Nevada Memorial Hospital Foundation, and I thank you all for being here tonight. Savvy Women has kind of become a phenomenon, and I'm really thrilled that we're doing a wide range of programs and people are able to pick and choose the ones that are great interest to them, and I thank you all for coming out and hearing a little bit tonight from our hospital CEO, Kathy Medeiros. We're also going to give you all some opportunity to ask questions if you'd like to ask questions. And first of all, I've done something a number of times, and I haven't done it the last couple times, and someone said to me, I really liked it when you did it, would you do it again? And so that is, part of what is making Savvy Women special is the fact that you can come and meet other women. So I'm going to give everyone about 30 seconds, if you can just look around you and introduce yourself to someone that you don't know and haven't met.
I'm going to take a picture real fast. Awesome, thank you.
I do want to take just a minute to thank our sponsors, and I saw Kelly. Kelly, where are you? Kelly, thank you so much. Concierge Accounting, Managing Care for Professional Women is our series sponsor, and Kelly's just been amazing in her sponsorship for this. So please join me in thanking her. And Nevada City Engineering is a sponsor for this particular one. Yep. And the Lee and Dunn group, Janice Dunn and John Lee and Baird is also a sponsor. Because of our sponsors, we're able to offer this program free, and so I really do encourage you, as I do with all of our foundation events and activities, please consider supporting the businesses that support your local hospital and foundation. It's just so important. And with that being said, I want to get right into our program. The format that we're going to use tonight, and I'll introduce Debbie and Kathy a little bit more fully in a second, is Debbie and I have some questions that we thought might be of interest to the group. And we're going to take the first bit of the program and kind of answer some of those questions. And then we're always very interested in not only your questions, but also the myths and rumors you're hearing out there. Believe it or not, there's a lot of myths and rumors about, the hospital out in our community. And what, you can really help us do tonight is really kind of come listen and help. If you hear those things in the community and you've been here and you've heard that different answer, we really appreciate the voices out there that help, really kind of get the messaging out. The other thing that I will just mention is that we have, I'm hosting a show on KNCO now once a month, the second Monday of the month from 1 to 2 called Your Health. And we're going to be covering a wide variety of health topics. Dr. Justine Corbett was my most recent guest. There she is right there. Yay, thank you, Justine. You made me look like a star. It was my first official one by myself, and so I really appreciated her coming and being my guinea pig for that. But we're going to cover a wide variety of health and wellness topics, not only from the hospital, from the community as well. So it would help me to know as we go forward if there are topics that you think you'd like to hear. So please, if you get a chance, tune in the second Monday from 1 to 2 on KNCO. Now I'd like to introduce Debbie Plass, who is the Vice President of Operations at Sierra Nevada Memorial Hospital. And Debbie has been here 30, not quite that much. 20. She's been there, and she's left and she's been back,
Yes.
which tells you how much the people that work at Sierra Nevada love being at Sierra Nevada. And I won't begin to go through all of the titles that she has because she has probably held almost every title at the hospital except Kathy's. And she's also an RN by trade. And Kathy Medeiros, our hospital CEO, has been at our hospital since March of 2006. And I have to tell you that I knew before I ever met Kathy face to face that I was going to love her to death. And that's because I do the legislative work for the hospital, and I was going back to Washington on an appropriation visit. She had not started at the hospital. I bet she's going to remember this. And this person that she had never met, knew nothing about, sends her this email with this letter that says, "Please sign this and trust me."
I made a few phone calls.
And she did, and we went back to Washington and got our appropriation. So I knew with that there was a level of trust that had been started, and so thank you. So I'm going to go ahead and let Debbie kick us off. And as I said, I'm going to watch time because we do want to honor your time. And so if we get to the point where, we need to open it up to the audience, we'll jump to that and then jump back to our questions at the end if we have more time.
Sounds good. We're going to have some fun here and learn a few things. And there are a lot of savvy women out there that I just think the world of. So thank you all for being here. And Kathy, I want to ask you a question that I know something about, but I got to learn something. And that is, how did you get into healthcare? And why did you choose leadership?
Well, as one of 7 children on a ranch, there were lots of injuries, and for some reason, I liked it. What can I do? So I always wanted to be a nurse. So that's how I started. I was the first daughter of 7 children, second child, and really liked caring for and dealing with emergencies and handling that. So that was always an interest. I did that. I went through school along with working tomato harvesters, cutting fruit, different jobs. Nursing is better. But that seemed to be my calling. To care for others was what I enjoyed doing. After a while, I started getting offers in the hospital say, could you do this or could you do this, with different jobs, and either managing a workers' comp program or working with the insurance companies, and it wasn't something that I typically worked with, but I thought, let's try it. So I started studying different things and found out that I liked that. I still miss the patient care, but what I found is if I care for the employees and care for the hospital and the community, that I have a wider impact, and I still feel that closeness to the community and the caregivers. And I do go around in the hospital, so I'm able to connect with patients and have that peace still in my day. So I love that. But that's always just been kind of who I am.
And I do want to recognize that we have several employees and physicians in our audience, so, raise your hand.
And board members.
Board members.
Raise your hand.
Yay. There they are. You're the heart of our hospital. We thank you. Debbie, I think maybe I'll have you go ahead and do the next question as well.
Okay. I know you've been in healthcare for a long time and in leadership roles and have seen a lot. So a lot of people are confused right now about healthcare in general and also about our relationship at the hospital with Dignity Health. So if you could explain a little bit about what the relationship is between Dignity Health, our hospital, and Sierra Nevada Memorial Hospital Foundation. Okay.
Well, and I actually read something the other day that said, if you're not absolutely confused about healthcare now, you haven't been paying attention. So it's an interesting time for us, and certainly we are as interested in what's happening as you are as we figure out how to manage to stay at the forefront, that we want to be providing the care. But this hospital has always been that way. I came here and this hospital was great. The hospital was always doing great. We always had a fantastic medical staff, great nursing care, which is one of the reasons that I came here. I worked for Tenet before, and I had 2 hospitals. I had a trauma center, it was 400 beds, and a smaller hospital that was 70 beds of acute care. and was not really interested in leaving until I was recruited to come up and talk to the people here. And when I came up and met with the medical staff, met with board, and met with some community people, I was out and about talking in town, and was so impressed with the quality of care and the quality of caring at this hospital, it made me interested in moving. So that's why I came here. Now, when I came, we were CHW. This hospital is actually a community hospital. It's a separate 501c3. The hospital is part of the community. It's yours. We're affiliated with Dignity Health, meaning that we work with them. We consider them great partners. We work together. We have many great economies of scale that help us work in this environment, but we're not owned by Dignity Health, not in any way, shape, or form. Our foundations are also separate, so Kimberly can probably address this more clearly than I can, but the Greater Sacramento service area, those hospitals are owned by Dignity Health, and they have one hospital foundation with a philanthropic arm, and those monies raised in those communities stay and they share in caring for those hospitals. This foundation is only for this hospital. So all monies raised here stay here and only for our hospital. Did I make that clear as mud?
Yeah, yes. So, another question that we hear a lot of times is, what does it mean specifically to be a community hospital, and why are there certain kinds of tests or procedures or programs that we choose to do or not do here?
Well, that's a good question, because our medical staff is so amazing and they have the greatest education, and we're so lucky to have them. It only makes sense that we would say, why can't we do these amazing things? Why can't we be a destination hospital for, say, Open Hearts? Well, part of that reason is that we don't have the community population to be able to do those types of services. When you have those kinds of services, you want to go to facilities that do several a day, tens a day or more, or thousands a year, because that's the kind of level of repetition, experience that you need to have that quality. So in a community hospital where we have a set population pretty much, we want to make sure that we're doing everything we can safely. And so we make careful consideration on what things that we will do in this community based on the population that we have. Also, we could probably recruit the best cardiac surgeon in the world, but he or she would not stay here very long because there just wouldn't be the volume for them. So we weigh those things carefully. We do community not surveys, but the
community needs assessment.
Thank you, the needs assessment. And it really looks at what kinds of disease processes or issues that we have in our community so that we're sure we provide those services that meet those needs.
I would just add too that Sierra Nevada is not unique in that. You'll find that in urban areas as well as in rural areas. That I remember a slide that our previous CMO, Chief Medical Officer Brian Evans, would show of all the specialties, and it was little teeny print on this slide, and it took up the whole slide, and it was, these are all the specialties, and it wasn't even a complete list that are out there right now. And I don't care if you're in a rural area, in an urban area, you cannot do all those things. So, hospitals have to make choices of what those most important things are. A great example of where, we made a different kind of choice was a few years ago when we determined it was probably an important step to become nationally certified as a primary stroke center. We looked at something, community need, and something that seconds are important. It's not just minutes, but seconds are important. And so the foundation, the hospital, the physician team all worked together and got the national certification as a primary stroke center. That was also when we got our first robot at the hospital, which I still, to this day, regret. It was Kimberly's robot at one point when we were doing the campaign, but then they renamed it.
Yeah, Dr. Eye on You, and I was in the ICU. I was in the ICU the other day and standing at the desk talking to somebody, and this machine comes by me.
Says good morning.
The screen looked at me and said, "Good morning." What is this? It was a doctor that was self-propelled, telemedicine, going in an intensive care area to examine a patient.
Yeah.
And now not only do we have robot in our emergency department, we've had telepsych, we have had stroke, ICCU, and we've recently received funding and are looking to expand with cardiac as well. So telemedicine, and again, that's not something you do just at a rural hospital. I can guarantee that some of the larger hospitals are using telemedicine more and more and more.
Have any of you experienced that yet?
Yeah.
Yeah. It's amazing how you just fall right into it. It doesn't feel odd at all once you have that conversation.
And you know, it's also interesting that, you know, just in case you're interested at any point, if you come on a hospital tour, sometimes we bring the robot in. So.
Well, I would add one last thing to add to what hospital services are. Even in big facilities, like in our greater Sacramento service area, we have two very big hospitals, Mercy San Juan, Mercy General. And we're looking at those hospitals and saying, do both of them need to have heart programs? Shouldn't we limit to have hearts at one hospital and neurosciences in another hospital? So even though they're both big, they both have population, does that make sense? So not every hospital is going to be doing everything any longer.
And we're going through some pretty big changes in healthcare, as you have seen, and at our hospital, we have to respond quickly. So Kathy, I'd like to ask you, what are some of the biggest changes you've seen that come to mind? Talk about it from our hospital perspective, or something that comes to your mind as far as changes in the hospital and how we're responding.
I think in healthcare in general, I think the changes are the reimbursement piece. It's always a challenge for hospitals in meeting the high costs that we need to deliver and being able to do that with a reimbursement level. So certainly the shifts in payers and what's happening with accountable healthcare has been a challenge for us. The shift in individuals' interest in going into the medical field, whether in nursing, in support services, or physicians, sometimes there's just not enough. I mean, that's certainly, I think Mark Freitas was quoting the other day about how many doctors are graduating and what the need is now, and it's like 4 times the need of what's available. So that's certainly a challenge. But fortunately for us, we live in a beautiful area, so we can attract physicians, but we're in competition with everyone else. Certainly, things that are covered in hospital care now are changing quite a bit. Back in the day, we used to get admitted the day before for surgery and make sure we were worked up and then have surgery and stay the next day to make sure that we were feeling okay. Now they're looking at joints to be same day. Or if you have a joint that you stay overnight, then you're expected to go home and not to go to an extended care. So that kind of elevation of care is quick. So we're not only responsible for educating the patient about what will happen, but bringing their family along with it because they're going to need that support. So certainly the care before hospitalization, care during the hospitalization, and care post-hospitalization. So now I call us the mother of Nevada County. Take your vitamins because you're going to have surgery, and did you do this after surgery? We're responsible for the health of the community, which we all feel in our heart because we're caregivers. That's we always have taken that responsibility, but now it's becoming a requirement. So those kinds of changes to me have been important, necessary, troubling, difficult, and it's time that they happen. So it's I always liken healthcare to now it's a Monopoly game. Every morning I come in my office and I flip the chance card. I think, okay, that's what we're doing today, because it changes that quickly.
So speaking of changes, we have some news that's out there in the paper and on the radio about news about our lab. So,
has anybody heard that yet?
Anybody heard that?
Everybody heard it?
Well, what's happened is that because of the cost of healthcare going up, the reimbursement of healthcare going down, and I'm sure Carrie could spend an hour talking about this, Carrie, our Chief Financial Officer, in looking at the types of services that hospitals are providing. Now hospitals are being really trimmed to provide acute care in a hospital, and reimbursement is following that type of logic. So things that we used to be paid that would cover the service of providing the labs and drawing the bloods and managing it, that has gone down significantly enough that we need to look at finding a community partner. Lots of things now that hospitals are moving off of will say, okay, this is not acute care anymore. Where can we find a community partner to take this on? They have a lower overhead because they don't have to manage a hospital, trauma, everything else. And now is the time for lab. So we're in discussion with a couple of different vendors to see who could best provide that service. In that piece in negotiation, we're talking about the labs and where they're currently located and keeping those open. We'll know more in April, May.
Yeah, there's a rumor, I think it was out in Penn Valley, that everyone's going to have to start going to Roseville.
That's not true. No.
Untrue.
You know, so often one of the questions I hear is, well, don't physicians work for hospitals? And why can't we seem to get enough physicians here? So Kathy, can you talk a little bit about what the relationship with the hospital is with physicians and physician recruitment and where we are in terms of our numbers for physicians?
Sure. Lots of people think physicians are employees of the hospital, and physicians are not employees of the hospital. They certainly work in the hospital, provide excellent care. They govern themselves and are not employees. There are physician models where physicians work for a group that contract for a medical foundation, which is why you'll see them working in clinics that appear to be owned by the hospital. So that being said, California does not allow us to hire and employ physicians except for a critical access hospital. So they can just now begin to do that.
And critical access is a very, very rural level of hospital that we don't qualify for.
It's 25 beds or less. And actually when I first, and they get paid better than we do. So when I first got here, I tried, said, well, you know, we're critical. They need us here. Let's talk about it. But I couldn't win that argument because we have well over 25 beds, and we have another hospital that's 35 miles. So there's very strict criteria on how that would work. Our medical staff, as I said, they're on their own. They go through medical staff leadership. What was the other part of your question with medical staff?
Where we stand in terms of
it's recruiting.
Yeah.
So the hospital is definitely a part of recruiting and retaining the physicians. And what we do is we work together with a Sacramento market with recruiting and advertising and bringing individuals in. But we work closely with the physicians or the physician group or the clinics that are looking for doctors. So we find the need that they have, we talk about that, we recruit and bring individuals in. That being said, the hospital, when a physician comes in, we introduce him or her to all the options that are available, and hopefully they'll choose the one that fits their practice the best because we want them to stay. So the hospital gets involved with not only recruiting and bringing them in and advertising, but also in setting up an income guarantee that gives the physician a time to get their footing, get known in the community, build their client base, and be able to manage on their own. So it's something that we're able to do in that piece.
That really gives us a leg up in our community to get people here that want to be here, because most of the physicians that I've known for years stay.
Yeah.
They love it here, they raise their families here, they're part of the business community. We get to know them, we socialize with them, and it's such an important part for our community. And I also just wanted to add that our hospital is a hospital that I've used for my family and myself. So you know that I think we've got great care and a great physician community because I bring my own family here.
Well, and they're very careful about physicians that they bring on board. And they know sometimes we are really hurting for a certain specialty, but the medical executive committee is careful because we need to be sure we have I call it the narrow bench. We're rural. We don't have a trauma center in our backyard. So the physicians are careful about who they let on the medical staff because they need to count on each other. They have to count on the quality and the expertise of the physicians that are here. So I think we need to be better than some of those hospitals. And the staff they're great about their level of scrutiny with physicians that are allowed to be on staff and join our community. So we can be grateful for that.
And something that kind of comes up from time to time also, people ask, well, why can't my physician come see me in the hospital? And, you know, what is a hospitalist and why do we have to have them?
Okay, very good question. When I first got here, almost all the doctors in town were rounding on their own patients in the hospital. They would admit their own patient, they would take care of them in their stay, and they would discharge the patient. As the physician practice became more and more difficult and they needed to see more patients, they needed to be in their offices more of the physicians said, I can't come in the hospital anymore because I could see 4 patients in my office. At the time, I could see 1 patient in the hospital. So they actually removed themselves from the staff to take care of patients in the hospital. And that's why we hired a specialty group called hospitalists, and they're specialists in hospital care. And that's what they do. They train for this. There's a separate, I think there's a separate boarding for that. And they actually are experts in patients in the hospital and can care for you there. Those specialists will communicate with your own private doctor to let them know that you're in the hospital. They share your chart so they know what your lab results are, and they talk to your doctor when you're discharged. So you're never left to without your doctor knowing that you're there. But that's why we have hospitalists, and that actually started before I got here, and it's now certainly expanded to a bigger one.
Well, and it's again something that almost all hospitals do now.
Oh, yeah.
You know, so it's not something specific because we're in a rural community. A lot of times people think things are being done up here because we're kind of in this rural environment, but they do it down in Sacramento.
They do, and actually in my other hospital, we had hospitalist program going 5 years before I arrived here. So it's not a new idea, and it's really quite good.
I equate it, I remember, probably the kind of challenge, with people understanding it has, similarities back to, remember when physicians stopped doing house calls. I'm sure when they stopped doing house calls, people probably had that same kind of feeling. Well, why can't my physician come to my house anymore? So why don't we open it up for a couple questions?
Okay,
Sure.
I would like to say something because my husband just got out of the hospital. He was there for 5 days. He had blood clots in his lungs and he had pneumonia. And the thing about the hospitalist is the critical nature of the nurses. To me, that is the most incredible thing this hospital has in terms of communication to the hospitalist. He came in on 11 o'clock on a Monday night, left at 4 o'clock on a Friday afternoon. He had 3 different hospitalists. And Kathy, thank you for coming and visiting. The thing that I want to say is this hospital is so important at recognizing the importance of the patient and the patient's need. And those nurses are amazing.
They are.
Because they communicate, they come in, they come out, they talk to each other.
Yeah, so here, nurses really
I can't say enough, and thank you. And the other thing I want to say, this community is amazing. I know Carrie Kennedy, I know Debbie Plass, I know Kathy Medeiros, I know Kimberly Parker. It's because we all work together and we all know each other. And I can't say enough for Kelly and Janice Dunn who are supporting this. I mean, this community is an amazing place to live.
And we've always had a community that's worked really strongly together, but a little bit on a positive, the craziness of all the healthcare changes has really pushed us to working together better than ever. And there are marvelous, incredible things that have come out of that. An example is our crisis stabilization unit at our hospital, where Sierra Nevada and our county were number 2 by I think a week or maybe a couple days in terms of opening up a joint community partnership crisis stabilization unit to deal with mental health. And there's so many different collaborations we have, and I honestly do believe that a lot of that has come out of the fact that so much has changed so fast that we've really all had to reach towards each other to kind of find creative solutions for our community.
Thanks, Barb, for sharing that. Did you?
I just wanted to point out Dr. Jeanette Carpenter here, our chief of surgery, who is just she is one of those powerhouses that really creates a great atmosphere of communication and making sure that we're working together for the best of the patients. And I just said, you're an amazing powerhouse, and I just love having you working with us, so thank you.
Other questions? Come on, there must be questions or rumors. Liz.
Well,
Oh, I'm sorry.
I have first
Yeah.
first a comment that your human kindness program is understated. The hospital just exudes human kindness. And I say that
Thank you.
overall. But I do have a question as to what category would you say the majority of your patients fall into? Would they be OBGYN? Would they be cardiac? Would they be cancer? What is the greatest need that you fill?
They fall into, it depends on the stage of their life. You'll see the one same patient is one day they come in, it's cardiac, and then it's medicine. But usually general medicine, medical cardiology, oncology, and then OB-GYN.
And just to throw some stats, you know, we deliver around 500 babies a year. That's going up a little bit. We've got a new remodeled family birth center. We handle about 30,000 cardiac and cardiac patient visits through our hospital a year. We handle about 20,000 patient visits through our cancer center program. Unfortunately, one of the things that's disappointing is the number of mammograms, and I think it's 7,000, I think.
Yeah,
it's going down, and I have to tell you, this is where the internet's really killing us, and this is where you all can help get the message out, because the internet's teaching women that they don't need to have mammograms as often, or they don't need to start at 40, or if you get to a certain age, you don't have to have a mammogram, and that's really something we really need to be you know, talking to our community about, because what we're going to start to see is more and more people follow that, is people are going to get diagnosed with later stage breast cancer at some point. So.
And really only in Grass Valley can you have a drink and chocolates
and a massage. Don't like mammograms. If you haven't done it, it's the best thing. Liz?
Two things. First of all, I just want to thank you for bringing the Summit group up. I think they've just been a wonderful contribution to our
Summit's orthopedics, just in case those that don't know.
Thank you.
The other thing is, and this is in the rumor category, is having lunch the other day with some ladies, and they were talking about a particular doctor who just happened to mention to these random women that what we do in our community is if a homeless person comes to the hospital, has something take place, that we'll keep them for 60 days. Can you address that? Is that something that we do?
No. Actually, and then I say no, and then I say, but it depends. It would really depend on what is wrong with a patient, what needs the patient might have, but as a general rule, you're homeless, you say 60 days, no. There are certainly diagnoses and issues and times that we have had patients stay longer than necessary because they don't have anywhere to go. And we have been known to buy a hotel room for a patient because it's kind and safe. If they've had an extensive surgery and they live under a bridge, we couldn't really in good conscience say, okay, good luck keeping that dressing clean. So sometimes we'll have them stay at a hotel and we provide taxi vouchers. But as a whole, as a rule, we don't necessarily, and I've never heard us say, and Carrie would kill me being the chief financial officer, to say you get to stay 60 days because you're homeless. No.
And this is an area we really have to work together with our community because, you know, for people who are homeless and, you know, have care and they're ready to be, you know, they're ready to they're medically stable, let's just say, the hospital can't be the bed for them. And so, you know, we need to work with Hospitality House and other, you know, entities to really find that ideal medical respite solution for that.
And I would add too that CORE has been helpful in that regard, Western Sierra Medical Clinic, Chap-a-Day, when we need partners and how to care for these patients. Some patients are not able to handle their own care, some patients choose not to handle their own care, but in partnering with them and figuring out the best way to handle some of these situations, it's very helpful because sometimes the patient requires an IV medication for 8 weeks. So maybe that's where the 2 months came from, is that they're thinking that we keep them in because they have nowhere to go. But sometimes it's medically necessary depending on what that IV is for. So we have worked with others to help us with that. And this community is great. In the Sacramento area, I go to all the meetings and I work with the other presidents of the hospitals. And this county is actually the poster child of people working together as a community to take care of the community. They don't have that same cooperation in Sacramento County for the Crisis Stabilization Unit, for CORE, for Western Sierra. They just don't have that type of collaboration with their hospitals. So this community makes our job so much easier, and it's very much appreciated.
And we have somebody at the hospital, her name is Stephanie Kreider, who works in partnership. Pretty much her whole job is focused on our community needs assessment, what services we need to deliver here, and partnering with the community agencies. And we give a lot of community benefit every year, millions of dollars of community benefit to this area.
Other questions?
I do, Kathy, if we could revisit the lab
Mm-hmm.
the press, is it likely that our lab in the hospital would be operated independently on premise?
The inpatient lab covers different things than the outpatient service. We're required to have inpatient services for emergency, for surgery, for inpatient care. So that will continue to be part of the hospital.
Thank you.
Mhm. Other questions? Over here.
So I'm just curious, how many employees are at the hospital? But yet the physicians aren't employees, but you know, I know in such a small community, it seems like there are so many people within this community that actually work right there.
They do. We have about 800 employees at the hospital. And you know, when you look at similar sized hospitals, we may have more than some, but we also have outpatient services that the employees are counted for. We have an ambulance service where the employees are counted for. So about 800 are just employed through the hospital. It's a good group.
Other
I'm
questions?
being a real hog. Kathy, what about our nursing staff? How do we recruit for them? What's the population like?
It's the same challenges in recruiting, although I would say we're pretty much fully staffed. We're very lucky. It's part of the community that, you know, this is where people want to live. And they're very well-educated nursing staff, so we're lucky there. But certainly, there aren't as many people that want to go into nursing, so we will recruit like everyone else, and by word of mouth and having it be a great place to work and having opportunity for them, that's how we're able to retain and recruit some excellent nurses. We're in a good place now.
One of the things I'll just mention, because it didn't come up when we were talking about physicians, is, you know, physician shortage is a crisis everywhere. It's really not just in our region. So one of the things that we are looking at is to bring in some PAs, some physician assistants, that will kind of help in those avenues. Many of you may go into doctor's offices right now where there is a physician assistant. So that's an area of focus as well.
And we've also set a program for our employees that if they help recruit a physician and the physician stays, they get a bonus.
Mm-hmm.
Yeah.
Linda, you had a question?
I was going to ask you, talking about the services provided to the community that are outside of medical care, and I know that you have a wellness classes program.
Yes.
But I think that a lot of us don't know as much about what's available and that kind of thing.
Absolutely. I'll talk briefly, and Debbie and Kathy can share something, because we have just an enormous amount of programming. One of our programs, the wellness classes, are available to the community. A lot of them focus on chronic disease, but we're looking at broadening that. In fact, we have a meeting next week to look at that. We also, and you can go to our website and actually sign up for classes right there. We also have, probably in April, our next wellness brochure coming out, which is going to cover classes from May through September. We have wonderful programs through our cancer center. Again, I have to acknowledge Dr. Corbett for really being innovative with us to design and create a pilot for our integrative medicine program for breast cancer patients. We also have, as far as we know, the only program that we've been able to find, Comfort Cuisine, through our cancer center, which provides comfort meals for patients that, you know, it's just a little too much to go home and cook after you've had your treatments. We support around 13 support group programs at the hospital, and they vary everything from very traditional support groups to things like Writing to Heal, and there's a new art class I know that's coming up that's being designed. Our Moonlight Mammograms was suggested. Our Alzheimer's program is really taking off and doing some incredible things.
We're getting the highest.
We're gonna also be starting a class for people who are thinking about having a baby soon.
Yeah.
And they can come, and I think it's called preconceptions.
Mm-hmm.
I know we're at our time, but I'm gonna put Kathy on the spot and ask for one final question, and then if you had questions that maybe were a little too personal to be able to ask in front of everyone, we'll stay for a couple minutes and we'd be glad to answer that. But Kathy, I just want to ask you, what are you most proud of?
At the hospital?
Well, I know you're most proud of that grandchild of yours. But
Yeah, my grandson, and I have a lot of pictures in case you want to see, and thanks to him is why I've got the 5-year-old droopy nose. But I'd say at the hospital, it's the fact that not only their education, I mean the education and the quality of all the staff, whether it's nursing, whether it's support, whether anything, physicians, their dedication, their knowledge is there. That is a trust. But it's that they really do care. They search out and they care for, and on their days off, they're out caring and working for the community and for our patients and dealing with things. I'm proud of that. I think that is amazing dedication, and it shows amazing heart, and these are things that are not necessarily getting paid for. It's just who they are, and I'm very proud of that in this community.
And I would just close by thanking both Debbie and Kathy for being here. And I would just tell you that there are often a lot of rumors in our community, and I really encourage you to call if you hear something. Let us know, because then we can address it. Occasionally, there's things that are happening that, aren't great, like, if there are layoffs or something, but for the most part, I find most of the things that we hear are really not true, and so any way that we can understand what's out there in the community, that'll help us as we message and go back out. And at the end of the day, I just want you all to know that, your hospital staff, your hospital leadership, they are really doing anything and everything they can in this community to ensure that you have the best care and the best health. And that, going forward, we really need to work as a community to make sure that everybody embraces the work of our hospital, because that's why we live here. We live here so that we can, we can have access to that care. And our hospital is in great, strong shape, but we want to be able to provide the best for you. So thank you so much for
I have
coming
one
tonight.
request.
Oh, yes.
I have always wanted to have classes and programs that get men to take care of their health. Now, can we talk? Getting men to come in. We're very good about taking care of ourselves and attending classes and reading and doing those things. Getting our husbands on board is very difficult. So if you can think of a way that get our husbands in, and that we can do it as a team, and we can do it with the kinds of classes they'll attend or the kinds of programs they'll come to, then let us know, because I think it is so important that we provide the care for our men, but to make it in a way that it's fun for them, they're interested, and they're engaged, because it doesn't work if they're not. So if you've got some ideas around that, I really want to know. I want my husband to be healthy too. So.
Thanks so much for attending.